So hi guys, Robbins 11th update on inflammatory myopathies is a major change. So earlier, no, inflammatory myopathies were classified only into three types: polymyositis, dermatomyositis, and inclusion body myositis. Now we have basically the Robbins 11th edition basically has classified myositis. So they've said that polymyositis is one of the rarest myositis. Okay, so in fact, now we have anti-synthetase syndrome, which has become very popular. Okay, so that's one. And what is dermatomyositis? So name itself says dermatomyositis. Okay, so whenever the inflammation affects derma, skin, myo meaning muscle. So skin and muscle both are inflamed, involved. That is one of the common myositis which we should remember. So here is the new classification of inflammatory myositis that you have to be very, very clear. Now coming to dermatomyositis, which is one of the important question that is asked to you in exams. Okay, so remember, dermatomyositis will have skin findings which are very, very classical, because dermatomyositis occurs, first understand the pathogenesis. It basically occurs due to vascular injury. So there it is an autoimmune process in which the complements are excessively activated, and MAC is formed which damages the endothelial cells of the vessels. That is why there is a lot of vascular injury. So therefore any muscle fiber which is just distal or around the vessels is typically affected. So that is why dermatomyositis typically has perifascicular atrophy. That is, the fascicles which are distal to the blood vessels, they are at the end, they are most affected. So that's a very classical muscle biopsy finding. Do you need muscle biopsy in all cases of dermatomyositis? No. So one, if you have a classical skin features, so what are the skin features? So again, it's a vascular injury, so typically has that the findings like Gottern papules or heliotrophic rash or V sign or Scholl sign. Okay, Scholl means at the back whenever there are pruritic rashes, or V sign. So that's very classical skin finding of dermatomyositis. The second is the classical antibody. So here is another update. The antibodies are classically defined in dermatomyositis. So these antibodies should always be searched for. So if you have a classical skin finding, if you have classical antibodies which are present, you don't need to do muscle biopsy. But if you don't have any of these, okay, and still the patient has proximal muscle weakness, then go ahead, do the muscle biopsy. You will see perifascicular atrophy, which is very, very classical of dermatomyositis. So till now, just for this, okay, we'll finish with this, right guys? Bye bye.